how do we make different decisions so that we can find the best types of doctors and not have to go through situations that are ultimately extremely expensive, extremely frustrating, and don't get you anywhere, right? So that's what we're going to talk about tonight. Before we dive into that, I just want to talk about numbers, about raw numbers. As we look at, if we're going to make constructive criticisms about medicine, look, and I'm a fan of medicine. I don't think medicine is bad or evil per se, but I think it's time to have some logical conversation around constructive criticisms of it. And so what you're seeing here is healthcare expenditures. Now, these numbers are United States, and this is in 2023, but in 2023, we spent $4.7 trillion. It's 1 year. Okay, now by 2031, we're expecting that number to be as high as $7.2 trillion, an increase on average of 5.5% per year. That's a tremendous expense, especially when you consider what we're paying for and what it's getting us. Now, if we look at some additional numbers, you can see here, this is medicine by the numbers. So this is $1,432. This is the average spent per American for prescription drugs. So this is just the prescription drug bill per person in the United States in 2021. If we're talking about quantitatively, that's $378 billion spent on prescription drugs in the U.S. And India was the source for nearly half of all the ingredients used in U.S. prescription drugs. Now, India, no offense if you're from India, no offense if you live in India, no offense if you're Indian, but India doesn't have the same set of standards as the U.S. and Europe. And as a matter of fact, there was a major expose about this written about the drugs that were coming from India and China being not what they're supposed to be, meaning the drugs themselves either didn't contain the accurate dosing or didn't contain the drug at all. If you're interested in this book expose, it was written, it's called Bottle of Lies. And I highly recommend any of you trying to improve your access to healthcare understands the information from this book. Bottle of Lies, it's an expose on the generic drugs coming out of India and coming out of China, and how it's very misleading, and these drugs that are supposedly saving us money are actually causing us to expend more money because the drugs are not actually effective and not doing their job the way that they should. So we spend $378 billion in the U.S. just on prescription medications. And if we compare this to other countries, this is healthcare spending in the U.S. versus the rest of the world. These are in dollar amounts, and you can see here we've got two types of expenses. We've got, in the dark blue, we've got government or compulsory plus voluntary spending, and then in the kind of light green color, we've got household out-of-pocket expenditures. So that you can see these are some of the top industrialized countries, you know, Korea, New Zealand, Japan, UK, Australia, France, Canada, Sweden, Netherlands, Norway, Switzerland, Germany, and the US. And you can see here in the US, we got $10,687 of expenditures. And again, this is per capita on health expenditures. So the US almost doubles the expenditure of the second closest country, which is Germany. So we're spending twice as much money and in many cases much more than twice, in some cases 3 times as much money than other countries. If we look at a kind of a breakdown of where some of this money is going, and this is money on prescription medications, you can see here, for every $100 that gets spent, 41 of those dollars goes to drug manufacturers, 19 of those dollars goes to insurers, 17 goes to production costs, 15 goes to pharmacies, and then $5 goes to what are called pharmacy benefit managers, and then $2 goes to wholesalers. So it's broken down that way so that you can see who's who's really driving the vast majority of the profit. Generally, that's manufacturers, and manufacturers are double dipping, because manufacturers, that's their production cost, but then they're profiting that 41 out of every 100. And I'm not opposed to people making a profit, but a profit needs to be precedented on an outcome that's actually beneficial. So if we look at that's expenditure. So we're spending that much money, and here is where it's landing us. In other words, this is what it's getting us. When we spend over $4 trillion a year, you would expect the more money that we spend for quality health care, the better care we would be receiving and the better outcomes that we would have. Well, here's life expectancy of the U.S. versus the rest of the world. In these major countries, we're ranked last, right? So U.S. average life expectancy 77, Japan is almost 85, Sweden 83, France 82.5, Canada 81.7, Germany 80.9, and the UK 80.4. So we are living 3 years or less than the next country. So we rank for life expectancy. If we're talking about in the world, we rank 60th. We spend more than anyone, by far, by double, but we rank 60th in life expectancy. So our healthcare bill is not reflected in our longevity, and that's part of the problem. What are we getting? What's the value in the money that we're getting for? And if we look at, some of these other issues, we look at who's manufacturing our medications predominantly. This is just kind of a little snapshot. This is by no means is this inclusive of all the potential legalities and lawsuits and things, but just a snapshot. Pfizer agrees to pay $93 million to settle a Lipitor antitrust lawsuit. Kansas Attorney General accuses Pfizer of misrepresenting COVID vaccine, hiding safety risks. Novartis faced new lawsuit over HeLa cell misuse claims. Lawsuit could challenge trust in Ozempic and other popular weight loss drugs. GSK, that's GlaxoSmithKline, knew about Zantac cancer risks. Attorney tells jury in first trial. Profits over patients. Philly DA goes after insulin makers and distributors on price fixing and collusion allegations. Pfizer agrees to settle over 10,000 lawsuits linking Zantac to cancer. Pharma giant GSK plunges 9% after U.S. court allows scientific testimony in lawsuits. How big pharma is fighting Biden's diagram to lower seniors' drug costs. Again, we have these, and then you take into consideration the Purdue payout. It was a $1 billion settlement for lying to the U.S. population and addicting people to pain medications and opiates. And then we have other cases like Merck's case, where thousands of people, I think it was over 60,000 people, had died from heart attacks due to false or misrepresentation of drug claims and drug treatment abilities. And so we have a long list of drug companies being taken to court and sued and either making payouts or losing because they're lying about their drug, they're lying about its efficacy or how it works, they're lying about its side effects, or they're lying about the medical treatments that it's actually capable of performing, or misleading the public. And so we have this is, this is a kind of a big thorn in the pharmaceutical industry. Then we have, we have other things. We have the CDC director, Thomas Frieden, this is the past director of the CDC, again, talking about opiates. We know of no other medication routinely used for a non-fatal condition that kills patients so frequently. We hope to see fewer deaths from opiates. That's the bottom line. These are really dangerous medications that carry the risk of addiction and death. Now, this was after Purdue Pharma pulled a fast one over the entire nation, over a battery of doctors basically pushing illicit pain medications to treat people's pain and getting people addicted, knowing that the drug was addicting. The companies decided to do it anyway. The doctors decided to recommend it anyway. And then we look on top of that, we have research coming out of major peer-reviewed journals showing that medical error is the third leading cause of death in the U.S. So here we're paying, remember how we started this conversation is we're paying $4.7 trillion for healthcare expenses to treat diseases like heart disease and cancer and stroke and asthma, etc. Yet, in this expenditure, and a lot of this money, as I showed you, hundreds of billions of dollars of this money are going to prescription drugs. If we look at how do we treat things like cancer and heart disease, how do we treat autoimmune disease, how do we treat obesity and diabetes, or metabolic syndrome, or bone loss, we use medications. And with that being said, medication error is the third leading cause of death. So we're spending $4.7 trillion a year to create the third leading cause of death of citizens of the United States. I mean, the system is obviously very broken. Now, I'm not talking about acute care medicine where you have trauma, where you're in a car accident or you fracture a bone and you need, surgical intervention or you need urgency care. There are a lot of lives that do get saved, and I don't want to take credit away from the system that's accomplished that. But when we're talking about chronic degenerative diseases, I like to call them diseases of choice, and you'll learn more about why I like to call them diseases of choice here momentarily. But for those types of diseases, people seek out their doctor's attention and efforts, but the doctor's attention and efforts lead to 251,000 deaths per year. That's the third leading cause of death. And when I say medical error, understand with this paper, what they talked about in this research study wasn't mistakes in terms of I gave the patients the wrong medicines or we operated on the wrong side. These are medical errors in terms of patients being actually hurt by the right medicines. In this country, we have something called polypharmacy. Polypharmacy means you're being prescribed more than one medication. Now, what you have to understand about drug research is that drugs are never studied under the auspice of multiple medications being prescribed simultaneously. Drugs are studied in single disease, single drug use research studies. So that, you may take 10,000 people and they all have X disease and you give them Y drug. But they're not taking in these research studies, they're not taking people with 3 or 4 or 5 chronic diseases and then putting them on 3, 4, 5, 6 different medications and measuring those outcomes. Because if they measured those outcomes, the research studies would never pass muster because those outcomes are horrible. That's what we're seeing here, is that polypharmacy is predominantly leading to excessive deaths from what they're calling medical error. And that's a problem. And we're spending $4.7 trillion to achieve medicine as the third leading cause of death. That doesn't make a whole lot of sense. Why would we keep justifying this expense? It's a massive beast and it needs to be reevaluated. But if we're going to reevaluate it, we've got to have the ability to talk